So there's bleeding. It bleeds easily when scrubbed, can spread to large areas of the organ. It can eat the whole of that side of the penis, like somebody eating one side of the fish, then turning it the other side. So also the same with the labia. It can eat the whole labia if not treated in time. Yeah. This one appears 4 to 10 days after exposure, after you've had sex with somebody with chancroid. Then within 5 to 10 days, you start feeling there's a swelling, there's a small bump. Then in 1 to 2 weeks, 1 to 2 weeks, it bursts and forms the ulcer. Yes, so that is chancroid. Chancroid has a painful ulcer, bleeds easily, and if not treated in time, it can eat the whole of that penis or the lip. Then you have syphilis. Syphilis, you can see an ulcer on the foreskin of this guy. Then we have syphilis has stages. There are 4 stages. The primary stage usually takes 21 days. 21 days, yeah, 10 to 90 days after exposure. Primary stage of syphilis is treatable. Very simple treatment. Just 1 injection is enough to treat syphilis. Usually the wounds appear on the mouth, the penis, the vagina, the anus, and these ulcers are painless. Usually they're painless, they're not painful. So most of the time people ignore because there's no pain, there's no need to go to the hospital. So if you don't go to the hospital, the wound disappears. It heals on its own without treatment. Yeah. Then it disappears. You become well. You feel you think you're okay, but the bacteria, syphilis bacteria, are in your system still because it was not treated. Then after some time, after 6 weeks or 3 months, we have secondary syphilis coming up. This one doesn't come with a wound. It comes with an itchy rash that covers the whole body, including the palms and the feet. We have spots on the palms and feet. At secondary stage, syphilis is treatable. It can be treated. If not treated, the rash disappears without treatment. If ignored, it disappears totally and you become well and you think you're okay. Then after 1 or 3 years later, during this time, it goes into hiding. We call it latent syphilis, hidden syphilis. 1 to 3 years, it takes 1 to 3 years later. But if you test blood for syphilis, you'll get the bacteria. And if it's gotten, it is treatable. So primary stage of syphilis is treatable. Secondary stage of syphilis is treatable. Latent stage of syphilis can be treated. But if you don't treat the latent stage, there's no symptoms, there's no signs, you don't feel anything, you're okay. Then after 10 to 30 years later, it comes as tertiary syphilis. Now it comes affecting other internal organs like the heart. You develop a heart problem. It affects the brain, you become mental. It affects your nerves, you have nervous problems. It affects your blood vessels and other internal organs as tertiary syphilis. So at this stage, syphilis is not treatable. So at primary stage, syphilis can be tested and found, even if there are no symptoms. Secondary stage, it can be tested, found, and treated. Latent stage, it can be tested and treated. But if you ignore it, it goes into tertiary stage. Yeah. So that's on a woman on the left side, you see the wound inside the vagina there. So secondary stage, you see the rashes, the one on top, that's the back of this guy. And you look at the mouth, there's those rash on the tongue. And if you look at the hands, we have the rash on the palms. The same rash on the palms can also be found on the feet. That is secondary syphilis. So the one on the left, far left, the 2 pictures are signs of secondary syphilis. Yeah. But the one on the left, the vagina, is a primary syphilis. It's the same as one, these are the guy's penis. All right? So syphilis can be treated. Syphilis is very easy to treat. Just one injection is enough. But if you ignore it, it becomes disaster at tertiary stage. Becomes mental, heart problems, nerves problems, blood vessels. Then we go to another condition, herpes, genital herpes or herpes. Herpes presents with a rash. You look at the left side, there's a rash on the skin. Some things swollen, feel like filled with fluids. We have herpes on the lips. Then we have herpes on the penis. So usually they are itchy. Sometimes with and if you look at the penis, those ones have already ruptured and they have formed scabs. Yeah, the ulcers are healing. This is a viral condition, and they say that when you have it, you stay with it for life. You miss Said, please mute. Yeah, so this is also an STI. It's a viral STI. When you get it, you stay with it for life, but we have drugs that suppress it, that it doesn't occur. Those wounds expose you to HIV because when you have wounds, then you're exposed to HIV during sex. And usually they say that sometimes you might not see it, especially if it is in women inside the vagina. You might not see the rashes. So you might not even know that you have it. But the problem is when you are pregnant and the rashes come, then you want to give birth, then these rashes, the virus will affect the skin of the baby during birth. That's why we advise that when you have herpes during pregnancy, it's advised that you go through cesarean section so that the baby doesn't pick it from the birth canal during delivery. So this appears 2 to 14 days after sex. So if you have sex with somebody with herpes virus, then in 2 to 14 days, you start having the rash that occurs. Then we have genital warts. Genital warts, the one on the left is a male. That guy is not circumcised. The warts are on the foreskin. And the one on the left, that is the vagina, the two lips. And those are warts that are blocking the place. Yeah. The warts can be seen on the penis, on the scrotum, on the thighs, on the anus. And usually for ladies, find them in the vagina, in the anus, can even be at the cervix. And on the mouth, as we saw, we can see it on the lips, the mouth, the tongue, can even find it in the throat, the warts. These are sexually transmitted human papilloma virus. It appears 2 to 3 months after exposure. If you, Evelyn Mwangi, please mute. Evelyn Mwangi. Evelyn Mwangi, please mute. 2 to 3 months after exposure. It can take even up to 8 months for the warts to appear after you've had sex with somebody who had genital warts. So this is still genital warts. This is a male. Now this is a serious one. The female, the whole of that area has been eaten up by the warts to the extent of the anus down there. So it's covering the whole of that area. Then we have cancer of the cervix is also an STI caused by human papillomavirus. Mostly, the people at risk of getting cervical cancer are sexually active young people. But now we are talking about adolescents. Those who started sexual activities below 18 years, and those who are having multiple sex partners, and those ones who are having a partner with multiple sex partners. So if you're abstaining and your partner is having multiple sex partners, you're also at risk of getting cervical cancer, because these other many partners this guy is sleeping with could be having human papilloma virus. Then you pick the HPV and bring it over to you. So those are the factors that predispose ladies to getting cervical cancer. If you start sex too early, yeah, and having several sex partners, how does it prevent? Cervical cancer presents with bleeding after sex. You have sex, and when the guy comes out, you see blood, bleeding and spotting after periods. You've had periods, and in the middle of the periods, you see spotting, or yeah. So sometimes if you have heavy bleeding or longer periods, you need to go for checkup to rule out early signs of the cancer of the cervix. Then if you have vaginal discharge that contains blood, you have the vaginal discharge like the ones we saw earlier, but if you look at it keenly, you see blood, then that could be a sign that there's something that needs to be checked up. If you have pelvic pains, especially during sex, when this guy goes deeper, you feel pain, or you feel pain during sex, then there's a problem that needs to be checked up. If you look at that diagram, you'll see the cervix eaten up. Oppo, please mute. So that's where the cervix, the cancer is. Cancer starts from the cervix. Then if not treated properly, treated in time, it spreads to other parts. So it appears, Monica. It's called Monica. It appears 5 to 30 years after the initial exposure to HPV virus from the man. So if you're exposed to the virus, then 5 years later to 30 years later, then you can develop the cervical cancer. That's why sexual activities at a younger age is a risk factor. So you might have sex maybe when you're 16 or 17, and 30 years later, you develop cancer of the cervix. We can screen our girls or women for cancer of the cervix. The screening starts at age 25. You do an HPV, you do the screening and the HPV test to check if the virus is there. And after screening, the first screening, then every 5 years, you need to go for pap smear or screening. This should go on up to age 65, right? Every 5 years, you go for pap smear or any other screening that's available at your facility. So we also advise that girls 11 to 12 years to go for HPV vaccine to prevent cancer of the cervix, though they can, even at 9 months, you can start. And currently, even can be given even up to 26 years, the HPV vaccine, but it's recommended between 11 to 12 years to go for the HPV vaccine to prevent cancer of the cervix in future. So cancer of the cervix is treatable at stage 1, when the infection or when the virus, or when the cells at the cervix, when the cancer is just at the cervix area, it can be treated. This is treated by surgery. We remove the whole of that portion of the cervix, then it doesn't spread to the other part. Sometimes it can be advised even the whole uterus to be removed during surgery so that you don't go into stage 2, which is affecting the surrounding tissues. Stage 3 goes to the pelvic organs and the abdomen. Then stage 3 goes to the other parts, like the bladder, the rectum, and the other parts of the body. So at stage, the other stages, like stage 4, now that one is complicated, right? So sexually transmitted infection can be prevented and controlled. Key messages that we need to have is like STIs can be prevented by being mutually faithful to your partner. So if you have a partner, please stick to that guy or that lady. Make sure he's not infected. You go for checkup together. Make sure you're free from all the conditions I've mentioned. Then you zero graze. Or you abstain from sex if you can. If you have not started, abstain so that you've seen the pictures. Just abstain before you get the right one that you can stick to, say is the best prevention method. Or you can, if you cannot abstain, then use condoms and use it correctly every time. Sometimes people use condoms and when they get used to each other, they sort of forget that they are, after all, they know you. So they don't use the condoms correctly. And the other one is the voluntary medical male circumcision. You realize that most of those wounds or the things are found on the foreskin. So if you remove the foreskin, and also you're also removing the HPV, because HPV is found under the foreskin. Usually that's where it resides. So if you're circumcised, then you're removing the environment where most of the guys stay. So STIs can be treated by taking all your medication. If you go to the hospital and the doctor has prescribed for you medicine, please take all your medication as instructed by the doctor. Even when you feel better, of course, after 2-3 days, you'll be feeling better after taking the medicine. Please don't stop taking. Continue until you finish the dose. Then after treatment, go back to that very doctor or clinician. Tell them you finished the dose that you're given, then let him or her advise you whether you're totally cured or not yet. So ensure that all your sexual partners, if you have sexual partners that you are exposed to or you went with, please advise them also to go for treatment so that we eliminate that cycle. So treating them, and after treatment, please, if you must, use condoms correctly every time. And the STIs are a real danger to your health. Of course, as you have seen, they make it easier to get HIV infection because of the wounds and interference of the mucous membranes within the vagina, and can cause other problems like infertility, like gonorrhea and chlamydia. If they go up through the urethra to the epididymis, to the testicles, then they are going to block the tubes. For women, when the infection goes to the uterus, to the fallopian tubes, then causes healing by scarring, then the scars will block the tubes. Then you're trying to get a baby, you cannot get because the tubes, the fallopian tubes are blocked because of gonorrhea and chlamydia. For the men, the tubes from the testicles to the urethra are blocked because of the infection of the chlamydia and gonorrhea. And if you have any swelling, you have any wound, you have any abdominal discharge, or any discomfort around your genitals, please, you could be having an STI. You need to go to the doctor or clinician or nurse for checkup so that they see whether you're sick or it is the normal vaginal discharge. Most STIs are curable if treated correctly. In fact, all the ones I showed you are treatable, right? If treated early, treated in time. Otherwise, thank you so much. Winnie, hand it over to you. Hello? People there?
Yes, we are hearing you, Doc.
Yes,
Great.
I am here.
Great. Nelson is cutting his hands. Right. Thank you, Winnie. Pick it up. Winnie is lost?
Yes, Doc.
Hands up.
Yes, Doc.
I've finished.
All right.
I'm seeing hands up there.
Yes. So at this point, I think we begin to take questions.
Yes.
So let's start with Rose. Let me unmute Rose. Rose, please.
Okay.
Yes.
Okay, I'm asking about, you see nowadays the youths normally when they get sick about it, STDs, they go for medicine. They are advised to take the herbs. Is it the
Herbs.
correct method, Doc?
They're advised to take herbs.
Yes.
Mhm.
Unapata mtu anakuambia ati hizo dawa za kienyeji ndio zitatibu hizo ugonjwa. So atuelewe. Unapata mtu amechukua 5 liters ati
Ex-
anakunywa. Okay.
Excuse me, Rose.
Yes.
I'll request you to speak fully in English because we have people even from South Africa. So please speak in English so that everybody can understand what you're saying. Thank you.
Okay. So you find someone going for herbs, maybe 5 liters taking so that he or he can be healed, especially male. Male. Is it the correct way, Doc, or what?
Take a few more questions before we answer. Think so, Winnie?
Yes, that's fine. We can take some more questions. So Nelson Waore, kindly speak.
Or the first one was who?
Rose. The first one was Rose. Now let's hear Nelson. Unmute and speak, please.
Hello, excuse me. Hello?
Yes. Odenyo Jacqueline, please. Scholar, unmute. Mute. Scholar, mute. Scholar, please mute. Scholar, please mute. Scholar.
Everybody has gotten there.
So you direct them, whoever carries up the hand should unmute, the rest will be muted.
Nelson doesn't have a question. Jerome Obwad.
Yes, I have a question.
Yes,
Nelson.
Yes, Nelson. Please,
morning.
Jeronim, get on hold, please. Nelson, I think he's saying something. Or if Nelson has disappeared, Jeronim, you can go ahead.
Hello?
Yes,
Hello?
Nelson. Yes, Nelson. Go ahead.
I have a question.
Go ahead.
My question is,
Nelson, please, we can't get you.
if a man has I'm saying that. Hello?
We're getting you. I'm getting you, Nelson.
Let's say if a man has a girlfriend, yes. If that person has a HIV.
Yes.
If now they don't advise on that.
Nelson keeps disappearing. I'm not getting
I'm
your
saying
question
that.
well.
I'm saying that. Hello, do you find me?
Yes, Nelson, we can hear you clearly. Just speak.
I'm saying that if a man has a girlfriend and the man is positive, even now they want to have sex. So what can you advise on that?
Hello, guys. Hello.
Yes,
Hello.
yes.
Yes.
Thanks, Nelson. Thanks, Nelson. Please mute. We have somebody else speaking. Thanks, Nelson. We have noted your question. Yes, please. Somebody by the name Samsung something. Please go ahead.
I'm asking if my girlfriend anajikuna akona rashes. Sasa I don't know what is the problem.
Please speak in English because we have people outside Kenya, so we also want them to benefit. So please speak in English.
Okay, I have a girlfriend that has rashes over the body. Hello.
Yes, that is noted. Thank you. Doc is noting them and will respond once. Thank you. We have Owaga, Vic, or Beryl. Your hands are up.
Excuse me. Hello.
Yes, Owaga.
Yes, I have a general observation and question. Because it's rising among the youth because they are becoming careless. They don't know when they are infected. and they don't know how to approach these situations. So one of the things that we are encountering is you find somebody just well learned, somebody educated, and then you see he has got the symptoms that can be addressed, but they just ignore. And then these things manifest to very complicated conditions. Then treating becomes a problem. So how can we, as a nation, like how do we take care of this negligence amongst the youth and the elderly in terms of approach to this STIs? It's becoming very common that if you have one or two contacts, you'll find yourself not very safe in all of them. So it means there is a very, very big negligence in terms of how we take care of our vaginal or reproductive health systems. So I don't know if these reports or maybe these feedbacks, we give them to the responsible ministry so that they can take immediate action. And then a question is also on how the treatment protocols. The treatment protocols are abused. You find, like we say, there are infections that you only need a single injection and it will be cleared. But you find that first line treatment, you are being given antibiotics, that some of them are not even directed to what you are ailing from. So misdiagnosis has also been another cause for increase of these infections amongst the youth and also the adult population. So I don't know if we have all these statistics and how we give them the approach. So there is the aspect of VMMC, medical male circumcision, which evidence tend to suggest that when you're circumcised, then you're not likely to get these infections. But some of these people, they are circumcised, they become too rough and careless. So instead of taking care, they become careless, and in the course, they spread all these infections unknowingly or knowingly. So I think there should be a clear cut. Even the circumcised also carry these infections and spread them. See, it's not that when you're circumcised, then you don't carry these infections. But I know the most prevalent people are the ones not circumcised. So I think that's a take home question for me.
All right, thank you, Owaga. Beryl, please go, or Jeronim. Jeronim, please go ahead. Jeronim.
Okay. Good morning, good afternoon, and good evening. So that's a pretty good presentation from Doc, and its STI is an issue that has been swept under the carpet for a long time. So my question is, how can STI screening and treatment be made affordable and easily available for young people? And also, how can we begin having conversations around STIs so as to fight the stigma? Yeah, we can have STIs, but not really having the confidence to go for the screening, or we cannot afford the screening or or treatment. So how can we make things better for young people to just access all these services?
Thank you, Jeronim. Let's hear from Beryl.
So the question is, I have seen that the doctor said that they can put things that you cannot be detected.
Excuse me, Beryl, your volume is too low. We cannot hear.
I'm asking that the doctors say that there are some STIs that when going for checkup, you can barely detect them. It can take like 2 years, for example, cervical cancer, or 5 years since infection. So I was asking, for instance, if you have been infected now and it takes 30 years for you for the infection to be seen, is that not so much damage? Is there anything that can be done for it to be seen, so that if someone goes to the hospital, they can get to know if they're sick as early as the time the infection has gotten into their bodies? Thank you.
Thank you, Barry. Let's have Alfred. Alfred, go ahead, unmute and speak.
Good morning. My concern is about our health facilities. You know, some maybe a youth has such a infection, STIs, but you get that they feel very insecure going